And we are back. It's still Mama's Nest, proudly powered by Cusson's Baby, makers of child skincare products to support moms on their motherhood journey. I'm still here with my guests, Dr. Abosede and Mobisola. We've been talking about the multitude of ways that pregnancy changes you. Carrying a baby is no small joke. It's no small task. Pregnancy changes you in so many ways. You can wake up today and find out that your nose is growing bigger, your feet are getting bigger. But in all of this, just know that it's normal. That's just your body adjusting to the hormones. And before we went on the break, you mentioned you were asking a question. Can you go ahead with that?
All right. I wanted to ask the doctor, like, is it possible that husbands can follow their wives for their clinic so that they can enlighten them on how the body of a woman can change during pregnancy?
Oh, and that it's normal as well.
So that's a very interesting question to ask. I think even men not attending antenatal care is actually depriving the men of actually enjoying the journey to fatherhood as well. So as a woman for 9 months, you get to talk to the doctor, all the complaints you have, someone allays them, and then you get to listen to your baby, you do scans alone, you get to hear your baby's heartbeat. The man is really not, you're just giving him like a lot of that. So men attending antenatal clinic is actually something that a lot of practices are already incorporating them. There are days that men come with their wives. Some have even taken it up to a level that men have their own like fathers sort of like meet up, that their wives are not even there, where they kind of educate them. But I totally believe that men should attend. I've worked in certain places where men do attend antenatal. Some men have their days. And a lot of couples, and you know now there's hybrid, both virtual and in person. A lot of men are participating in antenatal care. And really, for those that are with their partners and husbands, they are really the second doctor or nurse to their wives. They're the ones you run around to get you when your cravings come, when your back hurts. So they really are experiencing some of those things. So even them, it also builds their confidence that, oh yeah, your doctor said this, your nurse said this. Yes. So, and then again, also that bonding time. The baby is already in the woman's body. So for the man to have that 9 months to also prepare, the more education they get, the more access. I've seen men go for scans, and when they hear their babies for the first time, you hear them to like, you see them shed a tear like, oh, that's my baby, you know. So it's good for men to attend.
So men, it's good for you to attend.
It's good for you to attend.
It's not just to plant the seed. Please attend the antenatals. Go on the journey with the woman. In that way, it's also a form of you bonding with your baby.
With your baby, yes.
I remember when I was pregnant, my husband would go with me for antenatals. Sometimes he would drop me off when he doesn't have time to stay with me. But other times he would sit in and the scan. I think many men they endeavor to go for the scans at least. But it's a beautiful thing to see couples together. But I also noticed that my husband would walk into a place and say, what's that smell? I'm like, what smell? What are you talking about? There's nothing smelling here. You know, so there's a tendency to also lose smell. I don't know if it was also your experience.
I lost the sense of smell even after birth. For like almost a year, I couldn't smell anything. So if food is burning,
when food is burning,
I couldn't smell anything. I could not just smell anything. So I complained in the hospital. They were like, "There's nothing, just the changes." Yeah.
And there are also other cases where the smell.
It's not like they don't smell. Some is like everything smells bad. Maybe like your favorite perfume, you yourself.
Yes.
Someone sprays it and you're like, ew, this is terrible. Or someone comes in with a really nice smelling perfume and then you just enter the place and your face is all over the place like, what's that smell? I hate this. Like it's almost like the sense of the things you even smell of food. For some people that we talk about morning sickness, some people the food they used to love, even the smell, the scent of that food coming in, like they rightly told you, it's still part of that as your body is responding, your olfactory system. It's perceiving everything as nauseating. So even things you used to love. I remember even for myself, I had a problem with some roll-ons. Like if people around me use it, I just feel like, in fact, sometimes I say it's not only smell, it's giving me a headache. I don't want to smell it around me. So, I mean, different women so some lose their sense of smell, while some is more like of a change in how they perceive. And then immediately they give birth to the baby, few weeks or few months later, they go back to loving that particular smell. Or there's some like smells that even you find weird. Like, why would you be comfortable in this smell? Like, it smells nice. You're like, you're the only one that thinks it smells nice. Every other person doesn't think so.
Nice.
Yeah, so it does happen in pregnancy too.
Amazing. And then you also get to a point during pregnancy where you're really heavy and you're just tired. Like, can somebody just take this baby away from me? And sleeping is not very comfortable. Sometimes you're walking like a penguin, and it gets really intense. But what were some sleeping positions that you used to, make yourself more comfortable? You definitely can't sleep on your tummy, unfortunately, for a pretty long time. But what were some positions you used?
Sleeping on my side.
On the side?
Yes, on the side. Then using pillow because of my leg. Sometimes I put pillow on my leg so that I can sleep well. Then because of my swollen foot, for it to balance back, so I have to
prop it up with the pillow.
Yes.
The first pillow in between your legs?
No, 2 pillows underneath my leg.
That's how raising a leg up.
Okay.
We talked about that earlier on about because your blood volume and everything is more. The blood volume increases by sometimes as much as 50%. So you're carrying like half extra blood. So your heart has to pump more, and it may not be as effective as it was when it was like the regular volume. So you find a lot of women start having fluid independent area, which the leg is part of. So part of what we recommend for a lot of women is to keep, like once you're sitting, like as we're sitting now, you sort of raise your legs up. So it helps to like redirect the fluid upward as well. And then, you talked about sleeping positions. Please do not lie on your tummy. And then
you can't even lie. You have no choice. You can't lie on your tummy.
Some women will still, but it's funny. That's when they will say, and I feel comfortable this way. So you have to put emphasis on them not lying on their tummy. There are actually specific pillows that are sort of
maternity pillows
that are sort of tailored towards a pregnant woman sleeping. And then we talk about sleeping on the side as well. For a lot of women, as the womb gets bigger, it's resting on the big vessels carrying blood to and fro. So they say don't lie straight on your back. Turn more to your right, turn to your left, and then turn regularly, not just like, they say I should sleep on my... I've seen people that they will sleep on one side until that partner start hurting. Like if you stay there for a long time, you change to the right again. Like just do a bit of positional manipulation. And then sleep also helps in late pregnancy position. For some women, they have reflux late in pregnancy where it feels like it's still like that heartburn, but that food is coming back up, especially when they lie down at night. So for such women, we say, okay, sleep propped up, like raise your bed up or put some pillows at your back so that at least the rate at which the food is coming up can reduce or at least improve the symptoms that they are having.
There's also this urgency in going to the bathroom.
Oh my God.
Especially when you get to like third trimester, there's this urgency in going to the bathroom. And for me, it was so difficult because when you go out, it's not every time you want to use like a public bathroom. And also the scare of getting an infection because I think pregnant women are more predisposed to having infections. How did you cope with yours? I remember I had a friend then, she used to carry a container everywhere she goes, like, because he hated to use the public toilets. But how did you cope with that?
For me, I wasn't going out. Just clinic days because I was at home. So I'll just use the toilets anytime. Sometimes, I remember the day my mom was around. So I just left the bathroom and like I was feeling present. And I asked her that, Mommy, please.
What's going on?
I'm just coming back from the bathroom.
Why do I need to go again?
Why am I going back? And it was as if I wanted to pee on my body. I'm like, I'm just coming back from the bathroom. And so it was just...
you were lucky that you were at home. I think it's more challenging when you have to either go to work all the time or you go out. But why do we have to pee all the time?
Well, again, the bladder where we store urine and the uterus where the baby stays, they are very close to each other. So what happens is that as your baby is getting bigger, the womb is pressing on the bladder. So the space the bladder has to store urine is literally reducing.
Smaller.
So small urine, you have to empty because the space is smaller. Also, the kidneys are what we call the renal system. It works more in pregnancy. It's clearing more fluid. Like I told you, your blood, the fluid, everything has increased in volume. So the rate at which you're producing, your kidney is working. In fact, you hear some people say, when you lie down, as a pregnant woman, you are likely to feel like urinating than when you stand up. Because see, when you lie down, that positional thing allows the uterus to rest in a way sometimes that puts more even pressure on and also allows the kidneys to clear out and make more urine. So some women, they just say, I just came back and lay down small, 10, 15 minutes. It's like, okay, it's time to go again. So most times the renal system is working more. The uterus is putting pressure on the bladder. So the space left And for sometimes it's irritating, especially when the head of the baby starts to descend.
Oh, yes.
It starts irritating the neck of the bladder generally. So you start feeling, and then you go, you see it small. And then you come back, you're irritated again. A few minutes later again, you
Yes,
go.
you have
Some
to
can't
go
even
back.
hold it. A lot of pregnant women, at one point or the other,
Yes,
they
since we're
had a bit of
talking about this
incontinence
now,
too.
but why is it that when some women give birth, there's a lot of relief that comes to giving birth, by the way, but they still experience incontinence even after giving birth. When they cough and sneeze, they pee.
Okay. So one of the changes that happens in pregnancy, the inward that others don't see, is that the pelvic floor muscles expand. So normally the size of uterus is like a small pear. But by the time a woman gives birth, just picture how big that uterus is as well. So for the pelvic floor to support that big size, it also stretches.
Okay.
So the same pelvic floor that is supporting that is what is supporting all those organs that are the urinary organs for the woman. So even when the woman finally gives birth, that stretch that has happened there, it takes a while to go back. In fact, if you don't do anything, it's likely not to go back 100%. Now, this stretch we're talking about takes a long time if it's to be corrected.
Okay.
But before it corrects, a woman gets pregnant again. She has another baby, she gets pregnant again. So each time you get pregnant, you're stretching your pelvic floor muscles further. And then again, if you now have a vaginal delivery, sometimes you see it comes, all those tear cuts, things you're asking about, they also affect the pelvic floor muscles. So for a lot of women, even, I'm saying this because even if you have a CS, that stretch with pregnancy also affects you. Because I've heard women say, I don't want anything to happen to my pelvic floor, so I'm just going to opt for only cesarean section. The pregnancy, the weight of that pregnancy is going to still stretch your pelvic floor.
The pelvic floor.
So this is one of the reasons why we talk about, are we laying emphasis of pelvic floor exercises for women as well? Because that could help. So in a way, that loss of support is also a consequence of the weakness of the pelvic floor muscles that happen with the pregnancy or with delivery, like either ways for the woman. So you now see that they begin to have a bit of incontinence. Some even have it in pregnancy before they even deliver. And some even after delivery, if they don't pay attention to those pelvic floor exercises, they begin to have incontinence afterwards.
I think you tell us more about the pelvic floor exercises shortly. We need to go on a break. Thank you so much for watching. We'll be back in a bit, but don't forget that you can leave your questions as a comment or send it in as a message to any one of our social media handles. We'll be back in a bit. Please don't go anywhere. Welcome back. It's still Mama's Nest, and we've been talking about the different ways that pregnancy changes you. Before we went on a break, we were talking about incontinence in pregnant women, both during pregnancy and after pregnancy. But tell us, are there any ways that this can be managed? Is there a cure for it, either during pregnancy or after pregnancy?
So during pregnancy, some women start pelvic floor exercise, which most people know as Kegels exercise, even in pregnancy.
Does it help?
So it helps. So it helps if you do it in pregnancy. It helps when you do it after pregnancy. And it also just helps generally. For a woman's pelvic floor. Because one of the things that happens as we grow older, even when you move out of your reproductive age group, is that urinary incontinence also happens in women as they near menopause or even at menopause. So if you sort of firm up those muscles before you transition into that age, it's actually a win-win for a woman. And then the pelvic floor exercise sort of helps to reduce all those incontinence issues. So a woman that has had incontinence, maybe in pregnancy or after multiple pregnancies or multiple births, she already know this is part of the gap in care. She already know that it's possible that when I enter menopause, all these muscles that are already weakened, when estrogen is no longer as much as it used to be to support all these muscles, I may have incontinence in future. So such women should have pelvic floor exercises as part of, we've already talked about Kegels, and then the easiest way to explain Kegels, there are different modifications to it. Is the same way you hold urine that you don't want to pee on your body. You sort of do it for a stipulated time. Some people are so used to doing it that even as they are carrying on their day-to-day life, they are doing the pelvic floor exercises. You don't need any special time. No special time. So you just incorporate it into your life as you're moving on, knowing that it helps to reduce or even prevent incontinence in your reproductive age group, as well as when you transition into the menopause age group.
So, Bisola, do you know about Kegels? Did you use it?
Yes. I still do.
You still
Good.
do.
Yes.
That's good. That's good. It's good because you don't need, like I said, any special time aside. You can just sit at your desk at work and do Kegels. And these exercises are quite common. They are online.
Yes,
They're
they're on
online.
social
There's
media.
so many of them
They come
online.
modification and videos.
And so there's something I often hear, or I used to hear, that when a woman has given birth, so often, like when she has given birth to quite a number of children, that her vagina becomes loose and it's no longer tight. There's some men say that sometimes to scorn women. I don't know, is there any truth to it? Do you believe it?
For me, I think mine took about 3 months for it to go back to its normal size. It was very annoying and irritating. Yeah.
Okay.
So it took a while before it actually went back. And I was also doing the Kegels.
Doing the Kegels.
Yeah.
So I guess the Kegels help?
Yes, so the Kegels also. So again, all those muscles, the vagina, all those things people talk about, it is still a function of that pelvic floor support that we've talked about. So as the body begins to recover, if a woman incorporates pelvic floor exercise into a routine, it helps to refirm up those pelvic floor exercises. But also, it's also to be sensitive to the process that the woman has gone through. Having a child is not a joke. Like having a child is a tough thing to do. So even if because for a lot of men, it may not even be necessarily that. It may be more of a psychological thing, especially when you hear men that maybe they were privileged to be in the labor room, and then they say, look at the size of the baby's head that came out of this place, as there's no how you can tell me that this is what it used to be. But the truth of the matter is the vaginal muscles is elastic. If you can expand to bring out the baby's head, it can retract to what it used to be before. But for a lot of people, I find that people struggle through when they look at the baby, they're like, this baby came out of there, everything is no longer the same. Like, especially those that have like big babies.
It's spoiled now.
So again, that's also a mental thing for some. And physically, some need to just do that pelvic floor exercise to help them. And it's very important because I've seen women that's the reason they don't want to have vaginal delivery. They would rather opt for surgical delivery because they want to preserve. But they should also know that pregnancy is also, it stretches those pelvic floor muscles. It's not only the process of delivering the baby. So pelvic floor exercise should be routine, should be regular, should be repeated, should be done as often as possible for women. Yes. And men should be more sensitive to the fact that also destroys the confidence of their partners.
I want to ask, is the exercise that works, or is there any other way? Maybe there's an injection or drugs. So
people lately have been doing surgery. People have been embracing vaginoplasties, like reconstructive surgeries, out of necessity for maybe their relationship, or they think it will be better. But for those that it is like a big issue, they've explored vaginoplasty as a procedure to firm up their interests.
But have you ever had like any cases or any patients that has come to you to complain that, or have you heard of any stories that sex is no longer the same because my wife has given birth and it's not as enjoyable as it used to be before she gave birth?
So people complain about that. I mean, we've heard such complaints, we've seen such complaints, but then again, we have to rework the process as well, right? So sometimes couples stop enjoying sex with one another, not because they've had a baby physically alone, but because of what the baby they had has done to their lives. It's not just the fact that she's giving birth to the baby. They're not going on dates anymore. They're not sleeping well. The lady has been breastfeeding, the baby has been crying. She has not she used to be a slave babe with everything on fleek. Now she's, and then naturally, because of all the stress that's going on, her libido is zero. So everybody is stressed out, sleepless nights. The husband too has gone out. He has gone to buy a lot of things, diapers, food for the baby. He's also not sleeping well. Maybe the baby has kept all of them awake all night. So you find out that intimacy sort of, once you reprioritize your life, intimacy comes down, and then the needs come up. And then, we talk about how in our own society, babies are premium. So you find out that everything goes to the baby, the time, the love. If all of you are busy cooing and high and looking for who the baby looks like the most and all that, and then the family around you also comes into place. People are living with you, strangers are living in your home. You don't go for dates, you don't get to do your hair. The man too is just, so it's a combination of all. It's not just that, we had the baby, it's because the baby came out of there that we've stopped enjoying. In fact, sometimes when you are so busy, you're thinking of intimacy, and some will say in the process of intimacy, they're already planning their day. Like, let's finish this and move on to the next. So all of those things sort of affect sexual life after a baby comes in. So couples have to reprioritize their needs.
But what other ways did pregnancy change you, apart from the obvious ones that we have talked about?
Well, it changed my sex life a bit because I have so many things to do. So
Especially after the baby came.
Yes, I have to take care of my kids. I have to cook. I have to clean.
There's so many things to do.
Thinking about my husband's need is on his own. Yeah. So.
It's a lot of work. It did affect me in so many other ways. I barely had time for sex, low libido. Even when we actually got to it, I wasn't interested because I was mostly tired. From taking care of the baby, you have to do your chores, you have to cook, so many things to do. So it was the least of my priorities. Sex really was one of the least of my priorities. But then how can a woman better prepare for pregnancies? Anything that she can do for stretch marks, for instance, they say you can moisturize your tummy often, but how can a woman better prepare for these changes?
So for me, preparation from pregnancy should start before you get pregnant. There's something called preconceptional care or preconception care, which is something that we need to embrace more of, which is a woman seeking care before she gets pregnant. And the whole idea is, I want to go into this pregnancy as healthy as possible. So, but most times we find out what we have here is that women, when they are pregnant is when they now go to the... In fact, people don't come once, 1, 2, 3, 4. Studies have shown that antenatal starts for most Nigerian women between 4th and 5th month. So that means the first trimester itself is gone. And there are some things that could have been discovered in the first trimester and corrected or managed properly that will affect the... And some of those conditions will have even been best identified prior to pregnancy. So how pregnancy changes you is, one, embrace preconception care. And then we as a society and a community, we also have to talk more about these changes in a more holistic way, not what we learn in movies like we've rightly joked about, like what are the real changes, and then the gaps in care for you to know that, okay, it's not just how the pregnancy changes me outside. How does it change me inside? Who am I as a person that has achieved pregnancy?
That is another topic entirely on its own, because there's so many changes that go on mentally. Mentally
adjusting and all that. Because thank God that mental health is now taking center stage. A lot of people suffer through a lot in pregnancy, and there's nowhere to address it because people just gaslight it. That when every woman goes through it, so you to brace up for it. It is what it is, but it's different for different women. So it's preparation before pregnancy, having good care, having good communication, and then having support. You can't support of your partner, of your family, people around you to help you through the pregnancy, and even immediately you deliver as well, because it's a lot of work to be pregnant, and to have a baby.
Mobisola, quickly, I don't know if you had stretch marks, but how were you able to manage stretch marks, if you had any? Maybe I can learn from you and apply it to my few stretch marks.
So when I was pregnant, I was asked to buy bowel oil. But my stretch mark is still there till date. Sadly. Still there.
But are you still trying to treat it or manage it?
Yes, I am, because it's annoying. It's on my thighs, and like I don't wear bikini, but I'm just thinking, if I just want to wear a bikini, I can't even wear a bikini.
Because that's what we talk about, because the cause is not just outward. We talked about all those things that collagen, all those things that broke in all those components of your skin that changed with the pregnancy. Even if it heals, that's why we kind of talk about, you have to wear your scars with pride.
And cropped up.
And then people that are not pregnant do have stretch marks, So it doesn't mean it has to be. It's just the skin, the collagen, and all those things breaking there. People use oils like you talk about, but I've also seen women that did not use anything.
And
no stretch
my sister
marks.
doesn't have stretch marks.
And some people use everything, and they still have the stretch marks. Yes.
Can you please touch on diastasis recti?
No.
I feel like I'm professional.
Yes, for saying that. Yes, so diastasis recti is there's a muscle. We have rectus abdominis. So in some women, as the uterus begins to enlarge, it splits into two. So it's like a twin muscle, but it's together. So in some women, it splits into two, and then even after they have the baby, it doesn't correct itself. A lot of women talk about exercises to correct it. I've known few women that have actually gone all the way to even surgically correct it.
Here in Nigeria?
Every procedure is available in our beloved country, by the way. We've always grown. It's just that medical practice doesn't advertise here. You'll be surprised that we have guidelines to being able to advertise the expertise that is available. But everything is here. By the way, with pride,
as
we
long
say
as you
that.
have your money.
Everywhere in the world, as long as you have your money.
Yeah, of course.
One way or the other, you're paying for healthcare.
That's impressive.
Yeah, so it's here. People do a lot
Does
of
the
things.
waist trainer help to fix it?
I will not be able to advocate for for them because remember some pelvic floor support, some use belts to support. Whether it cures it or not, that's beyond my level of expertise. I know because it's a whole industry in zone that does all this waist training thing. It's more of like fitness lifestyle.
I know.
So let's ask those ones so that they can do that.
All right, I guess that's a discussion for another day. Thank you so much, Dr. Abosede Amosola. I really enjoyed the show. I enjoyed you sharing your experiences and your expert advice. Thank you so much. And thank you to our audience. Thank you for watching. This is Mama's Nest, proudly powered by Cousins Baby, makers of child skincare products to support moms on their motherhood journey. If you have questions, we would love to hear from you. Leave it as a comment or send it in as a message to any one of our social media handles now scrolling on your screen. Also, while you're at it, don't forget to like and follow so that you never miss any one of our wonderful content. You can also download the Mama's Nest app available for iOS and Android. So that's the show. It was an interesting one. Don't forget to look out for the next episode. Until then, see you next time. And Mom, you can do this.